10 minutes. I just kind of gave myself a second to know that we're going to be doing this for another month and probably longer than that. So do what you got to do, man. We're trying to track down, with this latest announcement, there are just so many questions that need to be answered for you, the people of Guam, and we're doing our damnedest to track down those answers. So
right now, 112 confirmed cases of COVID-19 on Guam, 23 recoveries, and 4 deaths.
And let's go to the phones right now. We have Adjutant General Esther Aguigui joining the show. Good morning, Adjutant General.
Sabrina.
Hi. So tell us about what the Guam National Guard is doing to battle COVID on Guam. If you could provide I
can tell both of you that when people see a member of the National Guard, they know that help is here. Our presence alone is powerful medicine. So we are helping combat this COVID-19 by responding to supporting the Guam Police Department. One of our efforts is also to provide increase our medical capacity. For example, we have Dr. Michael Cruz, who is also a colonel in the National Guard. He's also a surgeon, and he is leading the effort by being the governor's chief medical advisor to provide her with suggestions and recommendations on how to best battle this pandemic. In addition to that, our soldiers and airmen are providing crowd control for the Guam Police Department, helping them so that some of their resources could be better utilized in the community by enforcing the governor's executive order. In addition to that, even way before we activated some of our forces, we had our 94 CST Weapons of Mass Destruction team volunteer to conduct decontamination training for both local and federal agencies. And to date, there are over 300 state and federal employees who have been trained on decontamination processes. And I want to thank my 94 CST team for volunteering to offer that to the community. In addition to that, we have an aviation unit who is on standby in the event medevac requirements are necessary. We also have a complete we have a staff of medical personnel who are helping with the call to provide medical and healthcare professionals to kind of lessen an already taxed system. And then we have a 24-hour joint operations center that we have stood up to provide immediate answers and support to the soldiers who are on active duty right now. So we're
wow, that's a lot.
Yes, we're very involved. We're helping with public health, and we're also helping with the customs and border patrol.
Right. Doc. Are you a doctor too?
I'm not, but I'm a National Guard member, and priority is the health and safety of my National Guard members.
Right.
While I'm doing that, I have to ensure that we're still mission ready, and all at the same time, it's a delicate balance to do all that, and yet continue to provide defense support to our civilian authorities and support our state and federal partners.
General, could you talk about the role of the Guard and combat medics in terms of them supplementing some of these shortages that we're anticipating in the coming weeks?
Sure, I can tell you that what we're doing is we are providing assistance and support to increase our medical capacity. As you know, our healthcare providers are, they're our frontliners, and so are we. But more so in this case, our healthcare providers are the frontliners, and there's going to be a point where they're going to need some help, and our combat medics have a skill set to provide some medical capacity, not all, but some is better than nothing at all, and we have that skill set. and it's led by under the leadership of Colonel Michael Cruz, also known as Dr. Michael Cruz,
Right.
and in that surgeon cell that is embedded down at Adelup. One of the doctors who is also supporting that is another doctor of ours, who is Dr. Lewis Cruz, who is also known as Major Lewis Cruz.
Right, right. And in general, if you could just go over there, because they're kind of running the show, right? The surgical cell.
They are.
Surgical. It's called surgical cell.
Yeah. Surgicel, Bree, if you're in the...
In the
Surgeon.
know. Surgeon.
Oh, surgeon.
Surgeon cell, yes.
Okay.
And that we have a 7-PACS team, that's doing very tremendous work for the government of Guam for in combating this epidemic. We also have a Major Stephanie Tyron, who is also a licensed nurse practitioner, and she is also leading the effort. She is my official liaison between Surgeon Cell and the governor's office, and she kind of keeps a database from all the quarantine facilities and reports to me. She also helps to screen quarantine persons in the quarantine facilities, and she has a very meticulous database system where we can keep track of those who are in the quarantine facilities. And she is my bridge between Department of Public Health, Guam Police Department, the Surgeon Cell, and the Guam National Guard.
Mm-hmm. Major General, I know we got this release that some of our Guam soldiers, they returned home from deployment. Is that what we're going to be seeing? All of the soldiers and airmen that are on deployment in other areas starting to come home to help in this battle locally?
Oh, praise the Lord that they're home. I am so glad they're home. They were in Egypt for about a year. And yes, they will eventually be called upon to support all the ongoing missions if need be.
Mm-hmm.
And so they before they got here, they traveled from Egypt straight into Fort Bliss, and they were put under a mandatory 14-day quarantine period. And so they were screened. They had additional medical screening at Bliss. And when they arrived yesterday in the afternoon, well, what a great feeling to have soldiers return home and families just waiting for them. So upon their arrival, we had public health board the plane, and they all got screened for temperatures, and they were all asked if they were feeling, how they were feeling, and so they deboarded the plane. We put them on buses, brought them here to the Barrigada Readiness Complex. And we had additional screening from my medical detachment to check on their health and welfare. And as soon as they got their bags, we were also implementing our keep your distance procedures here in the Guard. So everyone was staying 6 feet from one another. Even the cars had assigned parking. Families had to stay in their vehicles. They could not get down. And we had a boy, if you saw our process yesterday, you would be impressed. I mean, I know that you're already impressed.
Send us some pictures. That'd be cool, yeah.
I think I got some.
Okay, cool.
This is a weld oil machine, and so when they were ready and they were cleared for screening, we reminded them that they were still under a self-quarantine order, and in addition to that self-quarantine order, they are also ordered on a restriction on movement. That if they're considered mission essential, they are allowed to travel from their home of residence to their place of duty and straight back to their home of residence. And that's one of the joys of being in command. That's the privilege of being in command.
A little different this time though, with all the the social isolation and having to adhere to these different orders, right?
Well, luckily that's not difficult for a military member.
Right.
And soldiers of the Guam National Guard who are highly disciplined. They are highly disciplined. We are professional grade, and an order is an order, and that's what they're trained to do. They are trained to, good order and discipline is I'm the keeper of good order and discipline, and so I have that in my rank and file, and I have absolutely all the confidence that the soldiers of the Guam National Guard will adhere to not only the governor's executive orders, but the orders that are inherent in them being soldiers and airmen.
General, can I ask, has there been any conversation with the governor? We know that in the press conference yesterday, she said she didn't have the authority to lock us down. I'm just going to say lock us down because it's just way easier. But she's asking the legislature to get involved. There's a couple bills. Has there been any conversation with you on what role the National Guard will play in the event that we do get these further lockdown measures passed? Are we going to see, guardsmen out in the streets? What is going to be the involvement of the Guard?
Well, what you will see, Chris and Sabrina, is that the National Guard will be in support of the Guam Police Department. Whatever is needed by the Guam Police Department as far as security and safety, we are here to augment that mission. So you may see us, scattered throughout the island, but it will be in support of the Guam Police Department.
Okay, I think we're good. I just want to thank you for your time. I know you guys are. This thing is really starting to ramp up, and I know with the surgeon cell and with the new extension of orders and people coming back. I mean, you guys have got a lot on your plate. So definitely talk about frontline. Thank you so much to you and your troops, and thank you guys for your service.
And thank you for sending us, the videos and the pictures and allowing us to salute you guys for everything you guys are doing. Thank you so much.
Well, you're so welcome. That's because I have a cast of phenomenal people. I have a staff, a very competent and able staff, and they make all this happen. I take no credit for it. Everyone does their part, and I can guarantee to the people of Guam that everyone in the National Guard will do our part in helping combat this invisible enemy, the invisible enemy called the coronavirus. But thank you, and I hope to talk with you on a daily basis.
Let's make it a habit.
Sure.
Okay,
right.
We'll see you.
Because you're part of the frontliners as well. So God bless you and stay safe. And por favor, saga gimamizo.
Yeah, stay at your
Stay
house.
home.
Wash your hands, General.
All right.
Okay.
Take care.
Bye.
Thank you.
Adjutant General Esther Aguigui of the Guam National Guard. Their involvement. Right now I think one of the big things that they're involved in is the activation of this surgeon cell, which is led by Dr. Mike Cruz, and these are the guys who are looking at what we got to do, where we're at, and what's going to happen in the next few weeks. Again,